Hello and welcome to this tutorial on reviewing and implementing sport safety policy. My name is Jared Mazel. I'm a certified athletic trainer at Good Practice LLC, and this presentation today is geared towards the International School Athletic Director. This presentation today will transfer some great resources that can be used to implement at your school um, and modified to fit the needs of your international school to serve your student athletes and risk mitigation for your organization. Again, I'm Jared. I'm an athletic trainer. This is a profession that's licensed and trademarked in the US, Canada, and Ireland. We're a fairly new profession to the international school industry, and I started in Concordia International School, Shanghai. Now I'm based in Brussels, Belgium, and I'm assisting ISB and St. John's International School. I started this company to create awareness and advocacy for the student athlete in the international school industry. Um, I feel that some services and some policy and protocols could be improved upon in the international school setting, and I felt motivated and passionate to try to bring some resources and tools to the administrators of these schools. So I've presented at a couple on this subject at a couple conferences, CEESA and MACE, and I've worked with schools all around the world almost to help improve their services to their student athletes. So these are the three primary subjects that I'm going to be addressing today. I'm not going to get into a lot of detail on the nuances of all these areas of concussion management, emergency action planning, and pre-participation exams or physicals. The purpose of today is to simply transmit really good resources to yourselves and your program that you can adapt and fit the needs of your students and department. Um, Sometimes when working with athletic directors, sometimes they face barriers in administering programming, either from other stakeholders, coaches, nurses, or whomever. So I get asked how do we circumnavigate this, and how do I arm myself to put forward this sort of policy and programming? Well, as your school probably has in place, this is child protection and safeguarding. We are protecting students' brains, we are protecting their lives, we are protecting them from catastrophic injury with this proactive policy and programming. So under the umbrella that, there may be concerns for child abuse, negligence, um, things of that nature, this falls underneath that. So I hope that um, yourselves and other athletic directors never face any pushback when trying to implement these sort of policies. But if if there is an obstruction, it can be perfectly rationalized that this is a part of your child protection strategy. One athletic director said to me one time, if we can't protect a child's life, what good are we? I think that's a really good, simple way to frame why we should be doing these sorts of policies. And one litmus test for your program is that ask yourself, reflect maybe, are you confident in all your coaches responding to an emergency? Are you confident and comfortable that they could respond appropriately according to your policies in an emergency situation? Now imagine you're a parent, it's your child. Are you comfortable with all your coaches handling that sort of circumstance? I would say most of the time, I think all athletic directors around the world would have a little bit of hesitation that even if they are conducting these sort of trainings, orientations, and have policy, they may show some reservations. So it's important for all of us to um, do everything we can to protect our students. Um, so one of my primary mission and goal is to help build a culture towards a safe and accessible international student athlete experience. Um, one of the one of the primary methods of doing this is promoting intercollaboration between athletic directors, and another way is with advocacy and awareness, presenting on these sorts of issues like concussions and emergency planning, and then assisting schools with updating, reviewing, implementing these sorts of policies. And today, I'm just going to provide you with the resources and tools for you to administer that at your school. Please know that there is no cookie cutter way to do this. Every school is different, every country is different. I encourage you all to explore the rules and regulations in your country and in your school before adopting this and making sure you're in compliance. Um, Please note that there is no static policy. Every year is going to change. Um, you may implement some sort of policy at your school, and you come to your first um, time your first instance of using that policy, and you may feel that this isn't the best way to do it. So it's best to have a long-term, strategic, and evolving approach to any sort of program that you may put in place, regardless whether it's sports safety or sport performance or anything for your department. Um, and please, last thing to note, coaches and parents want this. They want emergency preparedness. They want um, proper management of concussions with the students. They may not know that they need it. They may not know that they want it. But once these sorts of procedures are in place, they are very grateful for it. This is from personal experience and working with other schools. Um, Coaches may not initially fully understand why, but once this is in place and they experience it themselves, when they have an instance of a concussion or a student has a medical issue in the middle of a match, once they understand, they buy into it. So one of the problems in the international school setting is that we just don't have any accurate representative data to show the injury rates. Within our athletic conferences or at our institutions or in this setting and industry in general. This is very well documented in the U.S. and Canada and in the U.K. and some other European nations that track secondary school injury rates. But unfortunately, we really don't have um, any sort of statistics at the moment to show the injuries that are out there at the international schools. So I think there can be a underrepresentation or schools feeling that this is an issue for them, that we don't hear of the injuries that are occurring, the sudden cardiac arrests, the concussions that may lead to a catastrophic injury. We don't hear about it, so we don't think it's an issue. But in any organization that has athletics lends itself to a possible emergency situation, and there's a high risk associated with sports participation. So it's the moral and ethical obligation of the institution to be reasonably prepared. But here are some preliminary type of numbers to give you an idea. These are coming from international schools with athletic trainers. So some of my colleagues are putting procedures in place to document the injuries that they're encountering. So we do see some initial numbers coming out of some schools. So this is school number 1 in Asia. It's a school of about 1,800 students. In the school year of 2017 to 2018, about 140 schools in total. Your school may be different. You may be smaller, larger, but you can extrapolate from some of this information what you may actually be encountering, but are potentially unaware of at your institution. We do see, I'm just going to highlight a few things here. We do see obviously that rugby is going to be the highest rate of injury, obviously it's contact sport. And this school, the next was basketball and then soccer. Then I'm going to scroll down here to this point number 7. In this school year, there was 18 concussions. The year before, 22. These numbers would be similar to any school looking at the total population of the students and adjusting for that per capita number. From personal experience, during my time in Shanghai at international school, we did, on average, we saw about 1 concussion a month. So over the course of the entire school year, we had about 10 concussions. And that was a school without rugby. In addition to the head injuries, there were also 10 fractures, 10 broken bones, and 3 dislocations. So any one of these could warrant activating your emergency action plan. So not only the head injuries, but also the orthopedic injuries, we need to be prepared to manage these appropriately. This is school number 2, different school, similar population, about 1,900 students. The different graph to represent their data, about 125 injuries. And this graphic representation shows that indeed rugby was the highest hit sport in at this institution, and then boys soccer at second. So this is pretty similar to school number 1 that we saw. Now this is broken up by extremity. We have the foot and ankle down here, all the way up to the head at this end of the spectrum. So foot and ankle, that's what we do indeed see the most of, typically sprains and strains of the lower extremity. And then here I would like to highlight at the knee, 19 knee-related injuries. And this individual reported to me that 4 of them included ACL tears. So the anterior cruciate ligament is the primary stabilizer of the knee, and most of the time that does require surgery. So it can be a really great service to the international school if there's personnel on staff to assist the student with this entire start to finish process, like an athletic trainer or a similar health profession that can be the ones to initially evaluate the injury, manage it, treat it, refer it to the appropriate physician, act as a liaison in that process, and then if indeed surgery is indicated, to be able to do the post-operation rehabilitation, reconditioning, get them back to their sport. So these types of orthopedic injuries, these significant orthopedic injuries, are also occurring. And then lastly at this school, 11 head injuries. These were all indeed concussions. Okay, so similar type of numbers to what we saw at the previous school and my own personal experience. This is from a one-off tournament, a rugby tournament in 2017 of 6 schools. Here at the top graph, we can see the extremities that were injured. The top 2 were ankle. I'm guessing most of these were sprains, ankle sprains. And then here at the head, 6 concussions. Actually, this is going to end up being 5 concussions, and one of them was some sort of laceration, I guess. So we have 6 schools over a weekend tournament, 5 concussions. We see it down here in this graph. 5 concussions here, a dislocation, 4 fractures, a laceration, 4 sprains, 2 muscle strains. So this gives you an idea of if your school or conference is participating in a similar type of rugby tournament. This is something that you may encounter, and is your host site or is your school appropriately prepared to manage these sorts of things? Are there staff in place? Are there protocols in place to deal with that? Do coaches know what to do? Okay, so the purpose of all these numbers is to give you a sense of that these injuries and issues do happen. It's a matter of underreporting at the moment in the international schools. So concussions, Again, I'm not going to get into too much detail. I'm just going to briefly highlight why this is an issue. I'm defining it as altered brain function due to a force to a head. So the student athlete has taken a blow to the head for some reason, whether direct contact of a ball hitting them or a person's elbow or them hitting the ground. Any sort of violent mechanism or significant mechanism that causes the brain to move within the skull. A concussion is essentially the disruption of function um, of the brain, and all functions of the brain can become affected. Emotions, we see various symptoms like headache, dizziness, lightheadedness, difficulty remembering, difficulty processing. And the appropriate way to manage these is physical activity, complete cessation of physical activity, and also academic modification over a period of time while they're still symptomatic. Typical concussions last about 7 to 10 days, and they need to be withdrawn from their sport, and they may need to miss a couple days of school to completely rest, both physically and cognitively, to allow those disruptions at the brain to allow them to normalize. In our adolescent population, we are at risk to something called second impact syndrome. It is very rare, but it does happen. And what that is a concussion has taken place, and before the recovery has completed, they take a second blow to the head, usually of less significant force. So not even a direct blow, but just a whiplash type of mechanism, a forward back type of mechanism, can cause hyper pressure in the brain and cause permanent disability in neurological disability or even death. The pressure can compress the brainstem, and the student athlete can stop breathing and pass away. These are very rare, but it does happen. Another condition that's very common in this population is post-concussion syndrome. This is a concussion has occurred, and maybe it was mismanaged, or it could just been this could happen in just a one-off instance. There could be a variety of reasons why this occurs, but instead of resolving in 7 to 10 days, this occurs over the long term. They have those symptoms, that headache, that dizziness, that lightheadedness, um, emotional issues, depression, um, I state there, mental health impairment. Instead of it resolving over a week or two, this can occur for months or even years at a time if we mismanage the concussion or they have a long history of concussion. So we obviously want to prevent all of these um, issues from occurring, and the way we do that is by educating our people. There's two steps to appropriate concussion management: is the actual policy and protocol aspect, but also the educational aspect. So the education, getting everyone's base knowledge of concussions, raising all of that knowledge is the first step in managing this. So like I said, I'm going to be transferring resources to you, recommending these resources. And the first one is the NFHS, National Federation of High Schools. This is a online training program called Concussion in Sport, and this is geared mainly towards coaches, but it also can include parents and students as well. They also have a student version, and that language, the language options, English and Spanish, depending on which country you're located in and the population of your community. The next is the CDC, Center for Disease Control and Prevention in the U.S. Both these resources are actually from the U.S. This is called the Heads Up campaign, again in English and in Spanish options. This is a great resource for materials, for documents, to help your program, geared towards the nurse, the teacher, the student, the parent. There's a lot of good materials in here to convey information regarding concussions for your community. And then this is from Canada. If you're in a francophone country, it's called Parachute Canada. It's the Canadian version. It seems the Canadian version of the CDC for, and they offer English and French options. One of their programs is called, this is the Concussion Awareness Training Tool. This is a really good online platform for training your medical staff, any physios that you may bring on for athletic event coverage, your school nurse, your coaches. They have audience specific options coming from Parachute and CAT. Then the actual policy protocol portion. Nationwide Children's Hospital in Ohio in the US, they have a great concussion management guide, and they have audience specific to cover the administrator, which is definitely going to be the athletic director, then the educator side, the teachers, how they need to academically accommodate the concussed student, and then also for the parents, what at home they need to be doing. So they have 3 different guides to offer to those different audiences to tell them exactly what they need to do in managing a concussion. So here's just some screenshots to give you a sense of all of these resources. This is, again, the NFHS. This is Concussion in Sports. This is their online program. Here, they would just select non-US. I believe it says non-US state. And all these resources are free. They select non-US, they order the course, they enter in their email address and their name, and when they complete the course, whether it's your coach or parent, they get a certificate of completion, and that could be emailed to yourself for compliance and accountability. This is the Heads Up campaign. This is the CDC here. And like I said, they provide resources for all of the different stakeholders in managing concussions. They also offer an online training course for coaches and nurses. Personally, I like the they actually partner together, the NFHS and the CDC. But specifically for coaches, I think the NFHS is a great primary source. Again, here's Parachute Canada. This is the Canadian version, kind of the CDC. They offer French and English language options, and they have awesome online training for audience specific here. And again, I believe that this does a certificate of completion for accountability. Now, actually, the policy and programming side, this is the guide for administrators, what you're going to use to build your protocol and management strategy for concussions. This is, again, from the Nationwide Children's Hospital. So this is a great resource. It details all the members of the concussion management team, as well as the actual process to handle a concussion. So it has a step-by-step management strategy for you to adapt to fit the needs of your school. And they actually have a couple different models. So in their system, they can have a 2-liter model or a 1-liter model. So that means one person handling everything in regards to the student's care of concussion, or a 2-liter in which one person's handling the medical side, which is usually the school nurse, and then another person handling the academic side. So that's usually going to be the counselor, their assigned counselor. So in this 2-liter model, those two collaborate to manage both sides of the student's progression back to the classroom and ultimately back to the sports field in this model here. But a smaller school, it may just be one person, because maybe smaller school size, less resources and personnel available, but it all depends on your own institution and what your insight and experience indicates is the best to fit your needs. It's best to have a team approach and address everyone involved, and up to all of these different professions may be involved. Um, if if your school is fortunate to have an athletic trainer, they can be plugged into a major uh, centerpiece in managing the concussion process. So, how do you roll this out? For the athletic director, educate your people first. That is something an athletic director can implement right away, is to pick which training method you would like your coaches or parents or students to complete, either an online formal training program like from the NFHS, takes about 20 minutes, or is it, I'm just going to start out with sending a PDF type of 1 page or 2 page document that I would like everyone to read, and that may be good enough for me and my program right now to educate on what a concussion is. So educating first, that's the first step that an AD can do. For the next portion of actually establishing a policy and protocol, um, because it is a team approach, you're going to have to get administrators and your school nurse and the counselor and maybe even the head of school involved. So you're going to have to make sure that you have a good relationship and get buy-in from those colleagues of yours. Again, they need to understand why. Um, I'm reflecting back to the initial child protection and safeguarding aspect. Once colleagues understand why and that this is an issue that we're not really aware of at the moment, um, the chances are you're going to have buy-in and compliance, and they will end up being very supportive of the policy you're trying to launch. And then once you have that good relationship and you have that buy-in, you're going to need to collaborate to implement the protocol. It's going to take meetings, it's going to take some conversations to see how it actually best fits your institution, um, the route and management, the communication method, which tools do you use, and that's going to involve your school nurse, your counselor, your divisional admin, again, maybe the head of school as well. Um, and they're all going to have to collaborate and be involved in this process. And in not only in building the policy, but also carrying it out, obviously, once it is established. Now that's concussions. Moving on to emergency action planning. Again, the purpose of this is to simply transmit these these resources and tools to build your own specific plan. And why does the athletics department need its own specific emergency action plan? I generally, with the schools that I work with, generally they just go with the institutional emergency plan. Generally, it's a 1 page that that's on the wall, and it gives a few details on how to call the emergency numbers, things like that. Athletics department needs a little bit higher level of strategic planning and implementation and policy, because obviously there's higher risks in sports. It's more likely that if there's going to be an emergency, it may be something physical activity related, and time is critical in the event of a cardiac arrest or anaphylaxis or breathing emergency. Um, the quicker we are to respond, the more likely of a positive outcome there is. And we also host large events that include outsiders of the community, parents, guests, officials, um, from personal experience and from colleagues. Most of the emergency conditions they've actually had have been actually from the parents, the guests, and the officials, not necessarily the student athletes. So if we're hosting large events fairly regularly, it's something that we should be reasonably prepared for. And having an organized and rehearsed emergency action plan will reduce the likelihood of delay. So if we have a accurate plan and we review it regularly through, at least during the annual orientation of your staff, the greater the chances of a positive outcome there will be. Here's a brief list of some emergencies that can arise. Sudden cardiac arrest, anaphylaxis, like I said, utilizing the EpiPen, asthma, choking, airway obstruction issue, some sort of severe significant fracture dislocation, diabetic emergency, seizures. So we want to prevent and prepare to catch as much of these as possible when we're hosting schools from the outside, and also, just regular practices that we have with our own internal community. And again, this is a short list. There are many other conditions that may arise. Depending on your location, you may also want to think about the environmental issues. If you're in a really hot and humid environment, this is something that you're going to need to prepare for. So your EAP, it should be specific to your athletics department. Like I said, kind of a higher level for the higher risk sports. And there's also specialty circumstances that the normal institutional emergency plan may only think about the normal working day, the normal school day. Whereas in athletics, we have a lot of events on weekends, after schools, tournaments, and sometimes all the personnel that are typically there during the school day aren't there, such as the school nurse. We also may have some off-site venues. We may have some venues that are away from campus that we need to take a van or a bus to. We need to think about what is the best method of planning for an emergency at those locations. And then also, if a emergency hospital or clinic is designated, it may be different depending on the venue. Also, equipment, if you're at a different venue. Do you have first aid equipment? Do you have an AED, an automated external defibrillator that's going to is going to be the main tool to use in the event of a cardiac arrest? Okay, these are all things to think about. And then, are you rehearsing this? Are you talking about it? Are you implementing it in your annual training and orientation sessions with your coaches and parents? Two resources for this. The first one is to actually help you, guide you into building your EAP, anyonecansavelife.org. I believe they're partnered with the NFHS. And so this is a guide that's going to walk you through all the things to think about in your program. And then the Korey Stringer Institute from the University of Connecticut provides a really nice EAP template for you to build the actual document to build your emergency plan. So this is Anyone Can Save a Life. This is their website. They have a great website that has all sorts of online training. It even gives a sample of compressions for CPR online. And there are different portals and programs on here that you could choose to ask your coaches to go through as well. But specifically, I'm talking about for your emergency plan, this guide here. This is available on the website. It's about a 70-page guide, somewhere around there, I think. And it really details all the items to think about in your EAP in the athletics department. And it has some really nice resources in it and some documents in there. Obviously, all these resources, I apologize, are all coming from the US because that's my background and that's where I know. But these can be easily modified to fit the needs of your school. So for example, most countries don't use 911. That could just be taken and adopted to fit the needs of your school. So this may be above and beyond of what you actually need, but there's some great resources in here that you may choose to utilize. So that was anyonecansavelife.org. This is now the Korey Stringer Institute, and this is the template and guide to help you actually develop that document. So this is their website here, and they give a little information about EAPs, and then this is just a shot here of the table of contents, and it walks through everything to think about and to possibly address, you may not address everything at your institution, but you can address a good amount of these in detail in your document. And like I said, this is a template, so you can plug in all of your information. You can choose to utilize this or just, use this as a step-by-step process and ultimately use your own specific document. Your CPR, AED, and first aid trainings should be a part of this emergency process. Um, Again, time is critical in an emergency situation, and the coaches and yourself are ultimately going to be the first ones on arrival in an athletics related emergency. So I recommend that the training be a part of your orientation at least annually, if not offered more than once a year. It's ideal if within your community you have some instructors on staff. It'd be great to certify these coaches in a credential like AHA or ARC, the Red Cross or the American Heart Association, or other type of organization, whatever organization in your host country there. Make sure you maintain compliance with that, whatever the regulation is in your country. And like I said, at least once a year offer this training, but ideally offer it multiple times over the course of the year, because we know during the annual orientation, we're all humans. Sometimes a coach misses it, or something comes up at the last minute and something slips through the cracks, or you want to offer it more to just coaches, you want to offer it to students as well, or parents. So it's best to offer that throughout the year. And if it's not a true formal certification, at least some sort of training through either someone that is an instructor, ideally someone that is an instructor, but if they're not doing the credentialing, at least walking through the process of using CPR and an AED. Another method is also to partner with local organizations or clinics that do these types of trainings. A lot of times, if organizations can partner up with one another and make a mutually beneficial arrangement to offer, those courses on site at your institution, or at their clinic, that's another way to possibly contract out, or maybe there's a way to do it pro bono. That's why it's important to have a relationship with those outside organizations. One of those organizations also may be the embassy, the UK or the US or Canada embassies. A lot of them have instructors on staff that you could, if you extend an olive branch out to, they may be able to assist with your organization. From experience, I used to be an instructor. The American Safety and Health Institute is a really great organization. They have a very fair format and fair expenses associated with credentialing people in CPR, AED, first aid, and they really allow flexibility on the instructor. So if your institution is looking to offer more instructors on site, it may be encouraged that your coaches or yourself as the athletic director, or someone as a part of professional development, your nurses, you may want to take a look at ASHI, this American Safety Health Institute, and see if that fits the needs of your school. I would encourage you to reach out to them and have a discussion and see if that works for your school. Now, last is probably the most controversial part, is the pre-participation exam physicals. I know every school has its own way of doing this, or some schools don't have any sort of PPE requirement upon entrance into the school. I know we also work with a very transient population of in our community. They may not even have a primary doctor to go through. But I encourage all schools to investigate this and to possibly implement a policy or management way to do this at your institution, because this can serve as a preventative measure uh, before even getting to the emergency action plan phase, that you can pick up some of these issues that may be occurring in this young, growing adolescent population. So it's an opportunity to review history and general medical conditions with the doctor. Some things may come up that the student and parent weren't aware of. Doing heart auscultations, lung auscultations, or even orthopedically. And the biggest one we're trying to rule out is a congenital heart defect. About 1% of the population, roughly, has some sort of congenital heart defect that they may or may not be aware of. The most common, the leading cause of sudden cardiac arrest in athletics is something called HCM, hypertrophic cardiomyopathy, and this can be picked up on a physical exam. So if we can find these individuals before it's an issue, that's optimal, obviously. So if that's 1% of the population, take 100 of your student athletes, the odds are one of them has a congenital heart defect and doesn't even know it. Also, the orthopedic screening aspect to possibly identify issues like kyphosis, scoliosis, lordosis, hip, knee angle issues to possibly prevent injury or something from occurring. And also on your institution's end, it defers liability and helps manage the risk that you've mandated that they've gone and seen their doctor to clear them for physical activity. So I recommend taking a look at the American Academy of Pediatrics, and it's a 3-part PPE. The first part is the medical history questionnaire. It gives a overview on that what the doctor and the patient should be talking about and help guide and possibly put up some red flags that may need further diagnostics. So it helps have a conversation between the doctor and the patient. And I'll be showing each one of these. And then the physical evaluation, again, every doctor is different, every clinic is different, countries are different, regions. Everyone has a different method of actually doing the physical examination. So I'm going to be providing, the AAP provides one, but it's ultimately up to the doctor to decide on what they're going to look at and what they're not going to look at. They may have their own version of doing it. So in a physical evaluation, if they have their own method, then obviously go with that. But here's going to be the most important part, is the medical eligibility form. That's going to be the sign-off clearance on that, yes, they are indeed healthy enough for physical activity. Or if they're not, we're going to do these further tests and why, or they need this sort of modification, or they should have this medication with them at all times. Okay, so this is going to be your the key here, this last piece. So here's the questionnaire from the AAP. So the student and parent fill this out before their doctor's appointment, and they bring this with them, and they hand it over to the doctor, and they review this together and talk about anything that may come up. Family history wise, do they have lightheadedness with activity, which could be an indicator of a cardiac issue. Also reviewing possible mental health issues as well to help identify, or eating disorders, things like that. Then this is the part that's going to vary from doctor to doctor, the physical exam form. So actually what the doctor is doing during the exam. Again, this is going to vary. So this is why it's important and it's beneficial to have a relationship between your organization and a doctor and a clinic, to actually have a conversation with them about that. I would like for our students to do these physical evaluations, these PPEs, these physicals. What is standard practice here in this country at your clinic, and how can we, make this work that these kids are going to get possible conditions addressed. And then the last piece is the medical eligibility form here. This is the sign off that the doctor does to say, yes, they are indeed healthy enough for activity, or they're on these medications, and you need to be aware of that as the athletic department. But like I said, this is probably the most controversial. You're going to need to talk to your upper administration about this, that you would like to implement annual physicals for your student athletes as a preventative measure. And they're going to have to do their due diligence if this is a proper step for the school or not. Ideally, the more things that we can catch health-wise in students before they become an issue, the better. Like I said, every country, school, physician are different. That's why it's beneficial to have a relationship with a clinic and a doctor in your area to discuss this and see what works best for your institution. In addition to the annual physical, you should have in place a system at which parents and students can update their medical conditions by season. Typically, we have 3 or 4 sports seasons. An opportunity to update that. Medications change, conditions do change. So having the ability to update that information is important in the event something does come up. And then that information should be made available to the coaches. Make sure you're maintaining confidentiality, privacy, compliance, whatever that may be in your country and at your school. And then coaches should be aware of these issues and have a conversation with the student about it. An example is asthma, using albuterol, the inhaler, or if they have a severe allergy and they have an EpiPen, the coach should know where the EpiPen is, who has the EpiPen. Is the student carrying it? Is it at the nurse's office? Do they always bring one with them on the road for when they're visiting a team at an away site? Do they have the albuterol? Do they have an extra one on hand in case one runs out? A logistical conversation should occur. So in closing, thank you very much for listening to this brief tutorial. Well, somewhat brief, I guess. In closing, I would encourage all schools that as a centerpiece of your athletics department is that you have genuine caring as a part of your program. Not only caring about, in the academic side, on the performance side, and the health and safety side, knowing that physical activity is an important part of life and the student experience. We want to offer everything we can to make that available to the student, but we're also going to be prepared on our end that if anything comes up, we're going to be able to take care of you as a student athlete playing for us. So I hope that with these 3 main key aspects, if as an international school setting and broadly globally within your athletic conference and then at your local school, we can make things better and safer for these adolescent participants. That we can have a big impact in preventing things like something foreseeable from occurring by taking reasonable measures. And if you have any questions, here are my resources. Here again, this presentation was originally done for CEESA, so I'll thank David Hughes again, I guess. You can reach me at Good Practice LLC on social media, on Twitter and Facebook. Also, my website, goodpracticellc.com, has all these resources listed. And I wish you the best in health at your school.